So a very good afternoon to our beloved lecturer, Puan Mazuin, and to my beloved friends. By the way, my name is Eli Kim Morris, and I am from the cohort DPH 18, and I currently studying at KPJIC Penang. So today the topic that I would like to present is regarding about my poster, which is about eczematic disorders among adults. So what are the factors present for like eczematous disorders? For example, frequent exposures to chemical irritants, and using hands without protecting the skin, and not drying the skin thoroughly, and lastly would be if you scratch or rub your hands. So what are the signs and the symptoms of eczematous disorders? For example, the common symptoms can range from itchy skin, crusting, inflamed skin, and also dry skin. And severe symptoms can include also such as blisters, oozing clear fluid from flare-ups, and also scaly patches. So what are there are several types of eczema. For example, the atopic dermatitis, which is a common form of eczema, which can cause inflammation, dryness, and itchy skin. So while typical in small children, it also occurs in any age, including adults too. So besides that would be contact dermatitis, which is also called as a allergic contact dermatitis, which is a form of eczema which is brought on by environmental triggers. So besides that also would be neurodermatitis, which is also called discoid eczema, and this form affects small patches of the skin, so it makes them itchy and scaly. Next would be dyshydrotic eczema. This type of eczema dries out the skin and can cause a burning sensation, rashes, and also blisters. And next will be nummular eczema, which also called nummular dermatitis. So this form creates a small rounded lesions all over the body, but especially on the arms and also the legs. So furthermore would be the seborrheic dermatitis, which is an inflammation form of eczema which affects your scalp. And lastly would be the statitis dermatitis, which is a skin discoloration on the legs, which looks similar to the varicose veins. So now I would like to discuss more about the recommendations for the treatments of eczematous disorders, especially to those adults, right? So firstly, would the recommendation for the treatment of eczematous disorder would be topical steroids, which is to reduce swelling and also itch. For example, betamethasone cream. Besides that, treatment for eczematous disorder would also be antihistamines, which is to reduce the swelling and also the itch. For example, taking cetirizine tablets or Zyrtex. So next would be moisture. So it is for cosmetic preparations and also used for protecting, moisturizing, and also lubricating the skin. So the example for moisturizer would be calamine lotion. It would be calamine lotion. And lastly would be antibiotics, which is to treat the skin infection. For example, such as ibuprofen and also acetaminophen tablets. So counseling for patients. So for the guide on using the products, for example betamethasone creams, it should be applied to the affected skin area for about 1 to 2 times per day for up to 2 weeks. So for cetirizine tablets, for adults, and they would be taking at least 10 milligrams once a day. So for calamine lotion, which is the moisturizer, for skin irritation, it has to be applied to the affected area, usually up to 3 to 4 times a day, or as directed by the doctor. Lastly, for antibiotics would be acetaminophen, or known as the PCM tablets. So adults can take a maximum up to 4 doses, or up to 8 500 mg tablets in total within 24 hours. So wait at least 4 hours between the doses. So that is all from me. Thank you.